All right, hello. This is going to be a quick introduction to doing the pre-assessment screening for the assessment module that we are going to be working on in group. So, first of all, everybody does the pre-assessment screening. What typically happens is somebody in your company says, "Hey, I need you to go see Joey on Friday. Call Mrs. Smith and schedule it." And you call and schedule and you go out there and do the thing from looking at somebody's intake paperwork. Ethically, I recommend that you do this process when you call Mrs. Smith to schedule so that you make sure that you are the right person, the right behavior analyst to go do this assessment, and you show up with the right information. Okay. So that's number one. You always do this, even if somebody else says you have to go do the assessment. There's nothing new that you need to go find out. I think it's best practice to call, talk to a family, talk to a caregiver, talk to a lead staff, talk to a teacher, wherever your environment is, and make sure that you are best prepared to go to the right place at the right time with the right information. Okay, now, number two is you do not ask the client these questions. This is information that you ask indirect questions or leading questions about so that you can get these answered. It's not questions where this is a checklist that you're asking mom. Okay, so I'm going to actually role play this for you in just a second. The third thing is, again, the point of this is to make sure that ethically you're the best person and most prepared to go out and see this family. Okay, so what does this look like? It's these 5 things that you want to find out. So, number one, is there a problem with behavior or something else? So, you're going to go see Mrs. Smith and you've reviewed her paperwork and you say, "Oh, hi, I see that I'm coming out to see Joey. You've had a recent change in behavior. He's being a lot more aggressive towards his little brother or sister, and you're concerned about that. I see that you're also going to see the developmental neurologist, whatever, next month. He doesn't really have a diagnosis yet, but you're wondering what's going on behaviorally. Great. Have you seen a pediatrician lately? Is his health good? Does he have ear infections or allergies? How's his pottying going? Is any pottying troubles? Okay, great. So that literally was 30 seconds of questions because I want to know if Joey's having ear infections, which is why he's beating up the little brother. I want to know if Joey has a UTI, which is why he's mad and angry all the time and doesn't know how to tell somebody. So asking a couple little quick questions, not full medical history. You might have some of that from the intake, and all the real nitty-gritty details will be discussed at your intake when you actually show up. You just want to make sure. So what do you do if mom says no? No, we haven't seen this, we haven't done that, we haven't gone here, we haven't gone there. My deal is always, I can't we are not supposed to recommend medical services to our kids and families. But um, so you may not go. You may not say, "Hey, mom, you got to go do this." But again, the idea is it would be great if your pediatrician says everything's fine, and then you just move on. Okay? So you want to find out if behavior is really the challenge or is there something medical going on. The second question, that again is not a direct question, is does the challenge require ABA or is some other discipline more appropriate, and why or why not? So my question for this is, wow, Mrs. Smith, that's great. I am glad his medical is all up to snuff, and I'm looking forward to coming out and seeing you on Friday. What other providers does he see? Oh, he sees speech. Great. What are they working on? Oh, that's wonderful. Oh, OT also. Oh, sensory dysfunctional, blah, 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 blah. Oh, interesting. Okay, great. Again, it doesn't mean you don't go, but it means, hey, mom, can you forward me those assessments, those assessment reports so that I can review that before I show up? Okay, you're wondering who else is on the team. If language is a big concern, maybe all of the difficulties, especially for a child who is young or doesn't have a diagnosis, might be because they don't communicate well. Now, does that mean they don't need ABA? No, but it means it's our job to figure out who are they seeing so we can be part of a team. Okay, third question is figuring out, can I address the problem or not? So Mrs. Smith says something about aggression, something about poor language skills, something about recent onset, and I've asked a couple of quick questions, and now I'm thinking, yeah, I can help her with this. I know verbal behavior, I know antecedent strategies, I know set expectations, I know um, early learner skills. Yeah, I think I'm pretty qualified. Or if Mrs. Smith is saying, he had a UTI, but we got it cleared. And my biggest concerns now, even though he still doesn't toilet, is the feeding. And he just gags and throws up all the time. And we can't get him to eat anything. And yes, he's seen the pediatrician. And yes, he's seen the speech pathologist. And yes, he's seen the OT. And I've really done some research. And I believe that a behavioral approach to feeding is really going to help him the best. And I go, yeah, I've never done that before my whole entire life. Okay, now again, it doesn't mean you don't go see this kid, but it might mean you go back to your supervisor and you say, hey, I've never done anything. I've never done anything with behavioral feeding. Where do I get this information? Who can mentor me while I go see this family? Is there somebody on our team at our company who's better prepared to handle this? Now, again, you may not say this to mom, and you may not say, oh, yes, I can address this. This is just a checkbox that you're filling out in your head so that when you show up, you're the right person to show up. Okay, next question. Will the environment support the effort? So in our ethics, the ethics say we don't prescribe interventions that the environment can't support. Now, maybe that's money, maybe that's time and hands-on. That can be all sorts of things. And so part of the questions here might be, I'm really looking forward to seeing you. Who else helps you out with Johnny? Oh, nobody. Oh, you work full time? Oh, he's in daycare from 6 a.m. till 6 p.m. every day? Oh, no grandparents? Oh, no support staff? Okay, so I'm hearing that single mom is pretty maxed out and she needs lots of help with this kiddo who has X, Y, or Z that I think I can address. But mom is telling me that her availability, her capacity right now to do some massive program is very small. Again, it doesn't mean I don't go see her, but it means that my expectations have to be realistic. And then this last one is the problem a behavior excess, too much hitting, kicking, spitting, yelling, screaming, or is it a skill deficit? I don't know how to talk. I don't know how to eat. I don't know how to use the bathroom. I don't know how to play. So you want to kind of get a vibe for that. Because when you go see the kiddo, you're looking for what type of observation do I need to do? What type of checklist do I need to do? Okay. And again, this should take you 3 to 5 minutes to get all of this information in a quick confirmation phone call. And by the end of it, now again, you may say this to mom or you may not, you want to be able to have a preliminary statement, behavioral statement of the concern that you can put together. So the teacher may say, Sean is having a bad day at school. And by the time I have asked some questions of the teacher and the parent, what I find out is that Sean is actually hitting other students in class and in the hallways 3 to 5 times per day. That's a different set of information that I'm going to show up with. Mrs. Smith says, I saw an increase in aggression and he's beating up the younger sibling. I need help. Well, by the end of my pre-assessment screening confirmation phone call I'm coming on Friday, I realized that Joey recently had a UTI. He has definite feeding issues and may be hungry all the time. He sees OT and PT for feeding issues as well as communication. He doesn't have a diagnosis of autism, but they're definitely seeing patterns that when mom is playing with the baby, then the older brother who doesn't communicate well tries to steal the bottle. Okay, so the brother, my client, is stealing the bottle from the sibling 3 to 5 times per day, and he gets yelled at by mom and gets put in his room in timeout, right? I've got a lot of information now that I'm going to show up differently prepared than just looking at a kiddo who's had a spike in aggression. Okay? So this is what we're going to talk about in group, and then you are going to find your client and try and make this happen with them. Thanks.